Presented by Dr. R. Kalyan Varma, Professor of Forensic Medicine and Toxicology. You need to hear this if you're a future doctor. Why is consent not just important, but crucial in the medical field? Let's dive into the legal and ethical perspectives that make it mandatory. Consent in medicine isn't just a formality, it's a cornerstone of practice. Under the Indian Contracts Act of 1872, consent is defined as an agreement between two or more persons who share the same understanding about a particular matter. But it's not enough to just nod and agree. Consent must be given freely and voluntarily by the patient. This means obtaining it without any form of coercion, fraud, undue influence, misrepresentation, or mistake. Imagine being a patient and feeling pressured or misled into agreeing to a treatment. That feeling? It's exactly what ethical medical practice aims to avoid. Now, let's talk types of consent. There are generally two main categories. Implied consent, which is not expressly granted by a person, but rather inferred from a person's actions and the facts and circumstances of a particular situation. For example, showing up for a vaccination could imply consent to receive it. Expressed consent, which can be verbal, like verbally agreeing to a procedure after a doctor's explanation, or written, which is often more detailed and includes risks and benefits. This is known as informed consent. Informed written consent is especially crucial. It not only signifies that you've been fully informed and agree to the procedure, but also serves as a legal document that protects both medical personnel and patients. Why does all this matter? Because examining a patient without consent can legally be considered assault or battery. Ethically, it disregards patient autonomy and trust, two pillars of modern healthcare. As future medical professionals, understanding and respecting the process of obtaining proper consent is not just about following the law. It's about respecting human dignity and building a trustworthy relationship with your patients. Remember, a well-informed patient is an empowered patient. So, the next time you're in a clinical setting, remember the power and importance of a simple word: consent.